Oral contraceptives. Although the OCGs have been used for the decades and disagreement continues about their safety and adverse effect, they nearly always contain a synthetic estradiol and a variable amount of progestin combination of OCS, but a few preparations contain only progestins. Currently prescribed OCCs contain a smaller amount of estrogens, like less than 50 micromg per day, and clearly have fewer side effects than those reported for the earlier formulations. Hence, the results of the epidemiological studies must be interpreted in context of the dosage. Nevertheless, there is a reasonable evidence to support the following conclusions. Breast carcinoma. The prevailing opinion is that the OCs do not cause an increase in the breast cancer risk. Endometrial cancer and ovarian cancer OCCs have a protective effect against these tumors. Cervical cancer OCs may increase the risk of the cervical carcinomas in the women infected with the human papillomas. And then acetaminophen. As therapeutic doses, the acetaminophen, a widely used non-prescribed analgesic and antipyretic, is most conjugated in the liver, and glucuronide or sulfate, about 5% or less, is metabolized to NAPQI and acetyl P-benzoquinoamine through the hepatic P450 system with very large doses. However, NAPQI accumulates, leading to the centrilobar hepatic necrosis. The mechanism of the injury produced by the NAPQI include the covalent binding to the hepatic protein and depletion of the reduced GSH. The depletion of the GSH makes the hepatocyte more susceptible to cell death caused by ROS. The window between the usual therapeutic dose and the toxic dose is large, and the drug ordinarily is very safe. Nevertheless, the accidental overdoses occur in the children, and suicide attempts using acetaminophen are not uncommon, particularly in the United Kingdom. In the United States, the acetaminophen toxicity is caused about 50% of the acute liver failure. The toxicity begins with the nausea, vomiting, diarrhea, and the sometimes shock, followed in a few days by the appearance of the jaundice. The overdoses of the acetaminophen can be treated in the early stages by the administration of the N-acetylcysteine, which restores the GSH. With the serious overdoses, the liver failure ensures, and the centrilobular necrosis may extend to involve the entire lobules, such as the patient do not require the liver often require the liver transplantation. Some patients also show the evidence of the concurrent liver damage as well. Thank you for watching.